This is my fiance, Taylor Obenauer. This is his sister, Sierra Holte. And this is my friend, Shannon. Should a drug that has the side effect of homicide be on the market? Lupron is a drug that has many side effects. The company that made Lupron has done a really good job at keeping the side effects on the down low. Lupron is used for very many reasons. The first reason is advanced prostate cancer. It does not cure the advanced prostate cancer, it only helps the person to live longer. The second reason it is used is for fibroids. Again, it does not cure the fibroids, it just helps with internal bleeding during the surgery. And third, it helps with early puberty. It does not cure early puberty, it just has a small chance that it will help. The main reason that Lupron is used is endometriosis. Endometriosis is when the uterine lining does not shed through the menstrual cycle, but instead it attaches outside of the uterus and it thickens and rips away, leaving scar tissue. Lupron is a very deadly drug. There are tons of side effects with Lupron. Some Lupron users are attempting to sue the marketers a bot. Lupron negatively affected me. First, for my first main point, there are many side effects of Lupron. According to the online article provided by laws.com, sponsored by legal firms dedicated to providing legal information, there are a lot of side effects of Lupron. Many are not included in the injection kit. Ones included in the injection kit are hot flashes, breast tenderness, spotting, swelling, weight gain, joint pain, and depression. According to the same online article provided by laws.com, sponsored by legal firms dedicated to providing legal information, many of the side effects are not included. Ones not included are general pain, bone loss, painful urination, loss of consciousness, headache, blurred vision, confusion, drooping eyelids, arrhythmias, and even suicide. And the worst side effect, in my opinion, is homicide. To review, there are many side effects of Lupron. However, many are not included in the injection kit. Second, users are attempting to sue the makers a bot. According to the Lupron lawsuits, many people that are prescribed Lupron are prescribed a series of shots. Rarely people get to their second shot and almost never complete the full series. Many people are trying to sue the bot company, but none of them have been effective with the side effects of Lupron. However, Lupron has had to pay $875 billion to settle price fixing. According to the website, risks.org published first-hand account of a life being ruined. Michelle Milliken killed her husband on May 25th, 1993. She has no memory of the tragedy, and she says that she does not remember having any control over her body. She is now serving the 11th year and has 7 more years in prison. She had no previous anger issues. She was happily married, and she was now trying to come to reality with how she killed her husband. Okay, third, to review my second main point, there are many people looking to sue because of the havoc brought on their bodies, but none have succeeded so far. For my third main point, I will talk about my experience with Lupron. Lupron negatively affected me. On March 2015, I took the Lupron shot. I was told that I had two options. I either could take Lupron or I could have a total hysterectomy at age 18, and that seemed a little soon. I would have definitely had the hysterectomy, that's what I wanted to do, but my family talked me into taking Lupron instead so I could have kids, possibly. The doctor only mentioned that I could have hot flashes. She said that was the only side effect, and that the medication that she would give me with the Lupron would stop the hot flashes. I should have known that she did not know very much because I ended up giving myself the first injection, which is malpractice because you're always supposed to get the first injection at the hospital. The first day I went to the ER, the first day I was on Lupron, and I had a heart rate of 135, and my heart rate is always 64. They did an EKG, gave me anxiety medications, and sent me home. I had been to the ER a bunch of times during Lupron, and I don't really remember much of them. I only remember two. I remember going into the emergency room and my blood pressure was so low that they were prepping me for surgery. And I remember going into the emergency room and watching my uterus contract on the ultrasound machine. And I was in the psych ward 3 times. I had an infection that caused me to lose all my tummy muscles and most of my leg muscles. I had physical therapy for months to get my muscles back. I was hospitalized for that infection also. But the worst side effect, I would say, of Lupron has been the memory loss. I remember waking up one day thinking that my deceased grandma was still alive, and I ran around forever looking for her until someone finally told me she had passed away 10 years ago, and that was really hard. I thought that we just hadn't talked in a long time, but she has passed away. Now I'm doing okay, I guess. I have a lot of pain, and I have the infection right currently that sent me to the hospital. The doctors are trying to keep it under control. I've had shots and I'm still on antibiotics. To review my third main point, Lupron is a deadly drug. You can see how awful it is by my experience. I have been affected in what I would think is the worst way, but in reality there's so many worse cases than mine. Lupron is a deadly drug and should not be on the market. Please sign a petition at petitiontocongress.com. Lupron is a deadly drug with many side effects, and a lot of users are trying to sue the company it bought. Lupron negatively affected me. Please go sign the petition to get Lupron off the market.